What if I told you that the reason your calf cramps when you walk has nothing to do with your muscles or your joints at all? And what if I told you that the same thing squeezing your calf muscle might also be quietly working on the arteries near your heart and your brain? Let me paint a picture for you. You walk out to get the mail. Maybe it's 100 feet, maybe a little more. And somewhere around the halfway mark, that same spot, every single time, your calf seizes up, tight, burning. Sometimes it feels like a Charlie horse that came out of nowhere. You stop, you lean on the mailbox, or you sit on the porch step, and within a minute or two, it's gone. Completely gone. Like it never happened. Most people take that story to their doctor, and they hear one of three things: sciatica, arthritis, or my personal least favorite, that's just what happens when we get older. I want to introduce you to someone I'll call Robert, a composite of the kind of patient I've worked with for years, because his story is the story I hear over and over again. Robert was 71, avid golfer, walked 9 holes twice a week until the walk from the cart to the green started to hurt. He assumed it was his knees. He'd had knee pain before. So he adjusted, he slowed down, he pushed through it, and he didn't think much of it for almost a year. What Robert didn't know is that his calf pain was not coming from his knees, his muscles, or his nerves. It was coming from his arteries, and it was his body's way of raising its hand and asking for help. Today, I am going to explain exactly what is suffocating your legs when you walk, why it happens at that exact same distance every time, and I will walk you through a specific, gentle, daily protocol that doctors actually use to help the body build its own detour around the blockage. Stick with me to the end, because the safety information in the middle of this video matters just as much as the fix. Before we go further, if this is useful to you, type the word vitality in the comments. It tells me you want more of this kind of video, and it helps this reach the next person who needs to hear it. I want to take a moment on why this particular pattern slips past so many people, including good, careful doctors. Pain that comes and goes and disappears completely with rest doesn't look like an emergency. There's no dramatic moment, no clutching your chest, nothing that sends anyone running for the phone. It's quiet, it's private. It happens on a walk to the mailbox, and it's gone by the time you're back in your kitchen. And because it's so easily explained away by things we already associate with getting older, like stiff joints or an old back injury, it's easy for both patients and doctors to file it under just aging without asking the one question that unlocks everything. Does this happen at the same distance, every time? That question is the whole key, and I wanted you to have it, so that if this is happening to you, you walk into your next appointment with the exact pattern already named. So let's talk about the actual mechanism, because once you understand it, this whole thing stops being scary and starts being manageable. The medical term for what Robert had is intermittent claudication, and it's one of the main symptoms of a condition called Peripheral Artery Disease, or PAD. Here's the simplest way I can explain it. Think about a garden hose. When that hose is straight and open, water flows through it just fine, even at a low trickle. That's your leg, sitting still, at rest. Your muscles aren't demanding much, so even a narrowed artery can usually get enough blood through. Now think about what happens when you kink that hose, and then you try to blast water through it at full pressure. That's your leg when you walk. The muscle wakes up and says, I need a fire hose of oxygen right now, because walking is real work for that tissue. But if the artery feeding that muscle has plaque built up inside it, narrowing the passage, that fire hose demand hits a kink it cannot get through. So what happens? The muscle doesn't get the oxygen it's asking for, and a muscle that is starved of oxygen does the only thing it knows how to do. It cramps, it burns, it aches. That is the pain you feel. It is not damage happening in that moment, and it is not your joints wearing out. It is a supply and demand problem playing out in real time, in the specific muscle that isn't getting fed. And this is the part I really want you to sit with calmly, because I don't want to alarm you. I want to inform you. The arteries in your legs are not a separate plumbing system from the arteries in the rest of your body. Plaque doesn't politely stay in one neighborhood. It tends to build up in a pattern throughout the whole system, wherever the conditions favor it. So if plaque has built up enough in the legs to cause a cramp you can feel and time on a stopwatch, it is entirely reasonable for your doctor to ask whether similar changes might be happening in the arteries feeding your heart and your brain. This is exactly why cardiologists often describe leg pain like this as an early warning system, and I think that framing is important because a warning system is not a verdict. It's an invitation to look closer, calmly, with your doctor, using the right tests while there's still time to act. That's a very different feeling than a diagnosis dropped on you out of nowhere. This is your body giving you information from a place you can easily observe, about a process that might otherwise be much harder to see. That's the why. Now let's talk about the 4 warning signs, so you know exactly what to watch for in yourself or in someone you love. Sign number 1 is the stop-and-go pain, and the key detail is consistency. If the pain shows up at roughly the same distance every single time you walk, and it eases within a few minutes of rest, that pattern itself is meaningful. It might be the mailbox. It might be one lap around the living room. It might be the walk from the parking lot to the grocery store entrance. Whatever the distance is for you, the fact that it repeats, almost like clockwork, is the detail that separates this from ordinary muscle soreness, or a joint that's simply cranky in the mornings. Random pain that comes and goes with no rhyme or reason is less typical of this. Pain on a predictable schedule, tied to a predictable distance, is worth paying attention to and worth writing down. Sign number 2 is what I call the ice-cold foot. Feel both of your feet right now, or have someone else feel them for you, since it can be hard to judge your own temperature accurately. If one foot is noticeably colder than the other, that's a clue that blood flow to that side may be reduced. Your body works hard to keep both sides equal in temperature, the same way it keeps both hands roughly the same warmth. When one side consistently runs cooler than the other, especially the foot rather than the whole leg, that's information your body is handing you for free. Sign number 3, I call the desert leg. This is about the skin and the hair on your lower legs and your toes. When a limb isn't getting quite enough oxygen-rich blood over months and years, the skin can start to look thin, shiny, almost stretched, like it's been pulled tight over the bone. And hair, which needs a healthy blood supply at the follicle to grow, can slow down or stop growing entirely on the shins and the tops of the toes, even in people who otherwise have plenty of leg hair everywhere else. If you look down and one leg looks smoother, shinier, or noticeably balder than the other, that's your desert leg sign, and it's one people often notice for years without ever connecting it to circulation. Sign number 4 is the night ache, and this one catches people off guard because on the surface, it seems to have nothing to do with walking at all. This is a burning or aching in the feet at night, often bad enough that people find themselves swinging their foot off the side of the bed just to get some relief. And there's a real mechanical reason that trick actually works, at least temporarily. When you lie flat, gravity isn't helping blood get down into the foot anymore the way it does when you're upright, and if the artery feeding that foot is already narrowed, the foot can become oxygen-starved overnight, even without any walking involved. Letting the foot hang down off the bed uses gravity to assist blood flow back into it, which is why it can bring some relief within a few minutes. It's not a strange habit or a bad sleep position. It's the body finding its own workaround. If any of that sounds familiar, I want you to keep listening, because there is something you can actually do about this. But I also want you to hear the safety information before you start anything, so let's do this in the right order. Here is the protocol that vascular specialists often call structured or supervised walking therapy, and I like to think of it as an artery rescue plan, because that's really what it's building. The paradox here is one that surprises a lot of people. The way you help this condition is not by avoiding the pain completely. It's by walking into the edge of it, on purpose, in a controlled way, over and over. When you do this consistently, your body responds by growing new, tiny blood vessels around the narrowed section of the artery. This is called collateral circulation, and it is essentially your body building its own detour road around the traffic jam. Step 1 is the baseline test. Before you change anything, you need to know your own number. Walk at a normal, comfortable pace on flat ground, and time how long it takes before that familiar cramping or aching starts. Not agony, just the first honest twinge, the moment you'd normally start thinking about slowing down. Write that number down somewhere you'll actually see it again. A notebook by the door, a note on your phone. That's your starting point, and it's entirely personal to you. Robert's number, when he finally tracked it instead of just pushing through it, was about 90 seconds. Yours might be 30 seconds, or it might be 4 minutes. There's no wrong answer here, only your own honest baseline, measured on a day when you're feeling like yourself. Step 2 is what I call the push and pause method. You're going to walk until the discomfort reaches roughly a 3 or a 4 out of 10. Mild to moderate, noticeable, present, Something you'd mention if someone asked, but never sharp, never crushing, and never something that makes you want to sit down immediately out of fear. When you hit that point, you stop and you rest, standing if you can, sitting if you need to, until the discomfort fully goes away. Not mostly gone, not good enough, fully gone. Then, and only then, you start walking again. That's one complete cycle, and it's the whole engine of this protocol. Step 3 is the recovery cycle, and it's simply repeating that push and pause pattern for about 30 minutes total, on the days you're able to. Some days that might look like 6 or 7 short walking bursts with rests in between. Other days, as your baseline stretches out, it might be 3 longer stretches. What matters most is the total time on your feet, and the consistency of showing up for it, not the exact shape any single session takes. Now, the safety note, and I want you to really sit with this part, because it matters more than anything else I've said today. If at any point during this walking, or honestly at any other time in your day, you feel chest pain, chest pressure, shortness of breath, or dizziness, stop immediately and seek medical attention. Those symptoms are not part of this protocol. They are not part of pushing through, and they should never be walked through or waited out. Before you start any structured walking program like this, if you suspect based on what we've talked about today that you may have PAD, the right next step is a conversation with your doctor, and very likely a test called an ABI, or ankle brachial index test. It's simple, it's painless, it takes just a few minutes in a clinic, and it works by comparing the blood pressure measured at your ankle to the blood pressure measured at your arm. That comparison gives your doctor a clear, objective, numeric picture of how well blood is actually flowing to your legs, rather than relying on guesswork from symptoms alone. This walking approach is something to build together with your doctor's guidance, using that information, not something to start on your own instead of that conversation. One more practical note, and it's a small one, but it matters. Wear proper, supportive, non-slip footwear every single time you do this. Comfort and stability matter just as much as the walking itself, especially since you'll be starting, stopping, and standing to rest over and over throughout each session. So how does this fit into a real week, the kind you actually live, with errands and grandkids and doctor's appointments of your own? For most people, aiming for about 30 minutes of this push and pause walking, 3 to 5 days a week, is a reasonable target to build toward with your doctor's guidance. It doesn't need to happen all at once, and it doesn't need to look impressive. Some of my patients do it in the morning before it gets hot. Some do it in a mall, walking laps in air conditioning. Some do it right in a long hallway at home. The setting matters far less than the consistency, and I want to be honest with you about the timeline because I never want to overpromise on this channel. This is slow, quiet progress. You are asking your body to grow new blood vessels around a blockage, and that is simply not an overnight process, no matter how disciplined you are. It can take several weeks before you notice anything at all. For some people, it takes a few months before that baseline number starts stretching out in a way that feels real and undeniable. But in the vast majority of cases I've seen, it does tend to move in the right direction, walk after walk, week after week, because the body is remarkably good at building its way around a problem when you give it a clear, repeated reason to. I think about Robert sometimes, months into his own version of this. He told me the moment that stuck with him wasn't some big dramatic breakthrough with fireworks and fanfare. It was ordinary. He walked out to get the mail one afternoon, came back inside, and was halfway to the kitchen before he even realized it. He hadn't had to stop. He hadn't thought about his calf once. That's what this looks like when it's working. Not a finish line you cross to applause, just one more completely ordinary walk to the mailbox that quietly didn't hurt. Once your legs are getting the circulation support they need, the next piece of this puzzle is strength and balance, because strong, stable legs are what let you actually enjoy that independence day after day, not just walk without pain, but move through your life with confidence. I've got a video right on the screen right now that walks you through exactly that, so if this one helped you, that's your natural next step. If this video helped you understand something about your own legs today, type independence in the comments below and let me know. And if there's a part of this that confused you, or you want me to cover in more depth, tell me that too. That's how I know what to make next. Thank you so much for spending this time with me today. I'm Dr. David Thompson. I'll see you in the next video.